Hello everyone, this is Local Anesthesia by Surgical Savants, a guide to incisional infiltration of local anesthetic. What are local anesthetics? Local anesthetics are medications that we use at the surgical field to decrease a patient from feeling sensation, especially the sensation of pain at the surgical site. When using local at the surgical field, we use a technique called an infiltration technique. The names incisional block, field block, and local injection are also used interchangeably to refer to local given at the surgical field. Local medications work by blocking the sodium channels on nerve cells, which inhibits neuronal conduction. So in simpler terms, the feeling of pain at the incision site is not able to be transmitted to the brain. This makes patients less anxious and more comfortable during and after surgery. As a registered nurse first assist, it is within our scope of practice to administer local anesthetics during surgery. This is something that you want to become comfortable doing. And as with all medication administration, there is a risk involved, so developing good injection technique is important. If you don't know exactly what you're doing, ask your attending surgeon for help. When are local anesthetics used? Local anesthetics are commonly injected during specific and predictable times in surgery. So let's review 3 common times that you will see local used at the surgical field. The first scenario is at the beginning of a case. At the beginning of a case, fast-acting local medication like lidocaine or lidocaine with epinephrine, epi for short, are favored to quickly numb the surgical site before making incision. Some surgeons like to inject with a mix of fast-acting and long-lasting locals prior to incision. A common example of this would be mixing lidocaine, fast-acting, and bupivacaine, long-lasting. Surgeons choose this mix for immediate numbing from the lidocaine and extended pain control from the bupivacaine. A second scenario where you commonly see local used is just prior to the closing and dressing of your surgical incision. In this scenario, a long-lasting medication is chosen. A common example of this would be bupivacaine. In this scenario, plain bupivacaine is favored. Adding epinephrine would not be appropriate as bleeding at this point in the case should be well controlled. A third scenario in which local is used is when you have breakthrough pain during a surgical case. This is especially relevant in cases that are not done under general anesthesia. In this scenario, a fast-acting local like lidocaine is indicated. Where are local anesthetics used? For a local injection to work properly, it must be injected around the nerve cells that are close to the surgical site. Local works because it stops the initiation and conduction of pain signals by blocking them from getting into the cell. I like to think of local as playing the role of gatekeeper in your nerve cells. When local is working properly, it keeps all those unfavorable sensations from traveling through your nerve cells and telling your brain you are experiencing pain. When we inject local into the skin, we aim to inject it into a layer of the skin called the subcutaneous layer. Skin has many free nerve endings in it, so you want to infiltrate the area around the nerve axons so that the transmission of pain stops and cannot be transmitted further. Warning! Please aspirate a little before injecting. The goal is to infiltrate tissues around the nerve with local, not to inject local medication into the patient's vasculature. Blood vessels and nerves like to share space with each other, so we need to be mindful of that when we inject. Why are local anesthetics used? The short answer to this question is they are used because we don't want our patients experiencing pain during surgery. But the better answer to this question is that not all surgical cases require general anesthesia, and not all patients are candidates for general anesthesia. Performing surgery with the help of local anesthetic can sometimes be the safest, most cost-effective, and efficient way to operate. So now let me give you a quick way to assess a situation to see if it would be an appropriate case to pull local for. I'm going to break things down into always, sometimes, and never. But remember, In medicine, there is one guarantee, and that is exceptions to what we are taught will always exist. So please do not take this verbatim. Here we go. Local is always used in cases that involve sedation or cases that are done with an awake patient. In these cases, we give local so that the patient is comfortable during surgery. Local is sometimes used in cases that involve general anesthesia. In these cases, local might be given at the very beginning of the case, or it might be given at the end of the case for postoperative pain control. In patients that have allergies, sensitivities, or a history of abuse with narcotics, local can be a great option for pain control. Local is almost never used in cases where a patient has been given a block by your anesthesia team. These are usually regional or spinal blocks that your anesthesia team is giving. And we do not give local in these cases because typically the area that the block covers will cover your surgical site as well. You also risk running into giving a patient a toxic level of medication, as the anesthesia team and the surgical team use similar, if not the same, medications for local. So, in short, if a patient received a block from your anesthesia team and your surgeon asks you to inject local, you should question why and consult with the anesthesia team as to what the safe dose is that you can give before injecting. And there you have it.